Welcome to our lesson on cardiovascular system conditions. In this presentation, we'll explore various conditions affecting the circulatory system, including an introduction to the cardiovascular system, anemia, embolism and thrombus, hemophilia, leukemia, myeloma, sickle cell disease, and thrombophlebitis, with deep vein thrombosis. Let's begin with an introduction to the cardiovascular system. Most cells in our body are fixed in place and cannot move around freely. Because of this, they rely entirely on the cardiovascular system to deliver essential nutrients and remove waste products. It's important to note that massage therapy may either help or hinder this vital process, depending on how it's applied. The cardiovascular system performs several critical general functions. First, it enables diffusion, the random distribution of particles throughout a fluid medium. Substances must be able to move freely, and blood and lymph provide excellent environments for this, helping the cardiovascular system maintain homeostasis. The system delivers oxygen and nutrients to cells throughout the body. It removes carbon dioxide and other waste products. The cardiovascular system maintains stable body temperature through vasodilation and vasoconstriction. It provides clotting mechanisms to prevent bleeding, offers protection from pathogens, and maintains chemical balance using pH buffers. Now let's examine the structure and function of the heart. The septum divides the heart into left and right halves. The right half of the heart pumps blood to the lungs, which is called the pulmonary circuit. The left half pumps blood to the rest of the body, which is known as the systemic circuit. Valves divide the heart into top and bottom chambers. The top chambers are called atria and have a thinner muscle layer. The bottom chambers are called ventricles and have a thicker muscle layer. The movement of these valves creates the characteristic lubbed-up sound of the heartbeat. Let's explore the structure and function of blood vessels. Vessels carrying blood away from the heart are called arteries and arterioles. Vessels carrying blood toward the heart are called venules and veins. The connectors between these systems are capillaries. Blood vessels should be continuous and unbroken. Arteries and arterioles have a basic tube construction with 3 layers. Looking at the structure of blood vessels more closely, capillaries are made of simple squamous epithelium wrapped with smooth muscle cells. They are permeable, allowing substances to pass through, but are also easily injured. Capillaries are very tiny, so small that red blood cells must line up single file to get through them. This is where the critical exchange of oxygen, carbon dioxide, nutrients, and wastes happens between the blood and body tissues. As blood moves back toward the heart, it flows through venules, then veins. These vessels have the same 3-ply structure of tubes as arteries. The tunica intima layer forms valves that prevent backflow, even working against gravity. The entire journey through both the systemic circuit and pulmonary circuit takes about 1 minute. Now, let's examine the structure and function of blood itself. Red blood cells, or erythrocytes, all look alike. They have a fast turnover rate and make up 98% of all blood cells. Their lifespan is about 4 months. They are shaped like thin discs with thick edges and are smooth and flexible. White blood cells, or leukocytes, are translucent and not white and come in several different subtypes. Continuing with blood structure and function, let's discuss platelets, also called thrombocytes. Platelets are cell fragments that are usually smooth but become spiky when activated. They move through the bloodstream looking for leaks and rough spots in blood vessels. When they find damage, they secrete chemicals that trigger the creation of tiny threads to form clots. It's important to remember that all blood cells are manufactured in red bone marrow. Now we'll discuss our first cardiovascular condition, anemia. Technically, anemia means lack of blood, but more accurately, it refers to a lack of oxygen-carrying capacity. Anemia is not so much a disease as it is a description of a condition. The diagnosis is identified along with the cause of the problem. Anemia can affect people of all ages, depending on the underlying conditions. In the U.S., approximately 3 million people have anemia. Women of childbearing age are affected more than others, and it's also common in people 65 years and older. The pathophysiology of anemia involves three main factors: blood loss, accelerated destruction of red blood cells, and suppressed production of red blood cells. Healthy red blood cells carry hemoglobin. Hemoglobin carries oxygen and turns bright red when oxygenated. A shortage of red blood cells or a shortage of hemoglobin leads to anemia. Anemia can be classified into several types. These include nutritional, hemorrhagic, hemolytic, aplastic, and secondary anemias. Each type has different causes and characteristics that we'll explore in detail. Nutritional anemias occur when the body is missing something vital for blood cell production. Iron deficiency is particularly common, especially for menstruating women. Folic acid deficiency can also cause anemia. Vitamin B12 deficiency leads to pernicious anemia and can cause nerve damage. Other nutrients like copper and protein, among others, are also necessary for healthy blood cell production. Hemorrhagic anemias result from blood loss, either from a major wound or a slow leak. Common causes include peptic ulcers, heavy menstruation, intestinal tumors, and other conditions. Hemolytic anemias involve the destruction of healthy red blood cells. When this occurs, splenomegaly and jaundice will be present. High reticulocytes will be found in the blood. Sickle cell disease is an example of a hemolytic anemia. Aplastic anemias occur when bone marrow activity is suppressed. This means all blood cell production is slowed down, which results in anemia, poor immunity, and increased bleeding risk. Aplastic anemia can be related to several conditions: autoimmune attack on bone marrow, renal failure, bone marrow cancer, and other causes. Secondary anemias are a result of underlying disorders. These include kidney disease, hepatitis, acute infection, genetic mutation, and cancer, such as lymphoma, leukemia, or myeloma. The signs and symptoms of anemia include fatigue, pallor or paleness, dyspnea or shortness of breath, tachycardia or rapid heartbeat, intolerance to cold, and heart problems such as arrhythmia and cardiomegaly. Treatment and medications for anemia depend on the underlying cause. Options include removal of the triggering agent, nutritional supplements, medication, transfusion, stem cell transplant, and other strategies. When considering massage therapy for clients with anemia, the risks and benefits depend on underlying conditions. Pernicious anemia can lead to impaired sensation, which requires special consideration. Conditions like infection or cancer carry specific cautions. On the positive side, massage may help with fatigue. However, massage therapy will probably not create lasting changes in blood cell numbers. Accommodations for clients with anemia depend on their underlying conditions and treatments. If tolerance to cold is an issue, plan on providing a warmer room and extra covers for the client. However, if the anemia is well managed, no special accommodations may be necessary. Now let's discuss embolism and thrombus. An embolism is traveling debris or a clot moving through the bloodstream. A thrombus is a lodged clot that stays in one place. Within the systemic circuit, these conditions have different implications depending on location. On the arterial side, they are part of cardiovascular disease. On the venous side, they are part of thrombophlebitis or deep vein thrombosis. This diagram illustrates the difference between a thrombus and an embolus. Understanding the pathophysiology of clot formation is essential. Blood vessels are large at the aorta, get small at the capillaries, and become large again at the vena cava. The same pattern happens with the pulmonary artery, capillaries, and vein in the pulmonary circuit. Platelets move through the system, constantly looking for rough spots or damage. When activated, a clot forms. Clots naturally melt on their own over time. However, sometimes clots form faster than they melt, which can lead to problems. Importantly, clots can only travel as far as the next capillary bed before they become lodged. There are several types of thrombus and embolism to understand. Venous thrombosis involves the development of a clot in a vein, and will be discussed in detail in the thrombophlebitis and DVT section. Pulmonary embolism, arterial thrombosis, and arterial embolism will each be covered in the following slides. Pulmonary embolism occurs when clots or debris on the venous side of the systemic circuit travel through the bloodstream. These can only go to the lungs, which is the next area they encounter, unless the septum of the heart has a hole, which would allow them to cross to the arterial side. Pulmonary embolism leads to lung damage and poses a serious threat of lung collapse. Several risk factors increase the likelihood of pulmonary embolism. These include other cardiovascular disease, recent trauma, especially to the leg, bed rest, surgery, perinatal conditions, and others. Pulmonary embolism is extremely serious. 25% of cases lead to death, and other complications are common. Arterial thrombosis is a complication of atherosclerosis. In this condition, clots form on the arterial side of the systemic circuit. Stress, inflammation, and other factors can contribute to the development of arterial thrombosis. Arterial embolism occurs when clots, plaques, or other debris in arteries fragment and travel downstream through the arterial system. This is a complication of conditions like atrial fibrillation, rheumatic heart disease, and damaged heart valves. Arterial emboli often lodge in critical areas such as the brain, coronary arteries, kidneys, and legs, where they can cause serious damage. The signs and symptoms differ between PE and AE. For PE, there are usually no signs or symptoms until damage has already occurred. When symptoms do appear, they include shortness of breath, dizziness, chest pain, hemoptysis, or coughing up blood, and other symptoms. AE are silent until damage accrues, which makes them particularly dangerous. Symptoms include numbness, weakness, coldness, blueness, and pain in the affected area. When an arterial embolus lodges in the brain, it's a sign of stroke. When it lodges in a coronary artery, it produces signs of a heart attack. Treatment and medications for embolism and thrombosis include blood thinners, anticoagulants, and thrombolytics to prevent clot growth and break down existing clots. If necessary, more aggressive interventions may be used. When working with clients at risk for clots, there are important considerations. If a client is at risk for clots, avoid techniques that promote or challenge cardiovascular flow. This could be a local or systemic caution, depending on the circumstances. Medications used to manage clots increase the risk for bruising, even with light pressure, for some people. However, bodywork that does not promote or challenge cardiovascular flow could be welcomed by these clients. It's essential to work with the client's healthcare team. A history of clots with no current need for treatment is considered safe for massage therapy. Accommodations and research considerations are critical when working with clients who have clots. If clots are known to be present, then decisions about local versus systemic cautions are needed, depending on the individual and their treatment. Clot management drugs increase the risk of bruising, so use lighter pressure. It's important to note that some cases in the medical literature show that massage therapy may have disrupted a clot and caused harm to the client, so extreme caution is warranted. Now let's discuss hemophilia, another important cardiovascular system condition. Hemophilia is a collection of genetic disorders characterized by the absence of plasma proteins needed for blood clotting. The condition is mostly carried on the X chromosome, which means it's carried by females, but symptoms appear in males. It's very rare in women, except for von Willebrand disease. The pathophysiology of hemophilia involves the clotting mechanism. When activated, thrombocytes release chemicals into the bloodstream. These chemicals work with clotting factors from the liver to weave fibrin nets, which form clots. 12 different clotting factors have been identified. Hemophilia is a mutation that causes a deficiency in one or more of these clotting factors. This leads to difficulty forming solid, long-lasting clots. Hemophilia comes in mild, moderate, or severe forms. The severe form is defined as having less than 1% of the normal level of specific clotting factors. There are 3 main types of hemophilia. Type A hemophilia is the most common form. It involves a low level of factor VIII and is mostly genetic, though an acquired version can occur. Type B hemophilia, also known as Christmas disease, involves a low level of factor IX and accounts for about 15% of all cases. Von Willebrand disease is a different problem altogether. It involves a shortage of pro-clotting chemicals secreted by damaged endothelial cells. It's a genetic mutation that can range from mild to severe, though it's mostly mild and often missed in diagnosis. Unlike types A and B, von Willebrand disease is not X-linked, meaning it's equally common in men and women. It's actually the most common inherited bleeding disorder. The signs and symptoms of hemophilia begin at birth. The umbilical cord may bleed excessively, which is often the first indication of the condition. As the child grows, excessive bruising and prolonged bleeding occur, even with minor injuries. As the person ages, symptoms include bruising, hematomas, or blood-filled swellings, nosebleeds, hematuria, or blood in the urine, and joint pain from bleeding into the joints. This bleeding can be trauma-linked or can occur spontaneously without any apparent cause. Hemophilia can lead to serious complications. The leading cause of death in hemophilia is intracranial bleeding or bleeding in the brain. Bleeding into joint spaces causes a condition called hemophiliac arthritis. Bleeding in muscles can lead to compartment syndrome. In the past, contaminated blood products used in transfusions posed additional risks, though modern screening has greatly reduced this danger. Treatment and medications for hemophilia focus on replacing the missing clotting factors. Exercise and weight maintenance are important for keeping joints and muscles healthy. When considering touch therapy for clients with hemophilia, severe hemophilia contraindicates rigorous body work with any risk of compression or bruising. On the positive side, gentle, light touch massage may help with pain and stress management. Clients with milder forms of hemophilia may need less caution and may be able to tolerate more pressure. Accommodations for clients with hemophilia require careful attention. Gauge your touch and pressure to avoid any capillary damage, as even minor trauma can cause bleeding. Clients with milder forms of hemophilia may tolerate more pressure than those with severe forms. However, most research recommends against massage therapy for clients with severe hemophilia due to the high risk of bleeding complications. Moving on to leukemia, which literally means white blood. Leukemia is a type of cancer that affects bone marrow function. There is significant crossover between leukemia and lymphoma, as both involve white blood cells. The pathophysiology of leukemia begins with white blood cell stem cells, which include myeloid cells and lymphoid cells. Leukemia is classified by its stem cell origins, either myeloid or lymphocytic. The disease occurs when stem cells mutate, leading to overproduction of non-functioning white blood cells. These abnormal cells crowd out functioning cells, resulting in several problems: low red blood cells and anemia, low platelets and bleeding risk, and low functioning white blood cells with suppressed immune function. Leukemia is classified into 4 main types based on the cell line affected and the speed of progression. These are acute myeloid leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, and chronic lymphocytic leukemia. Each type has distinct characteristics and treatment approaches. Acute myeloid leukemia is an aggressive form of the disease. It's usually seen in people over 60 years old. This type is linked to exposure to carcinogens such as radiation, chemotherapy, benzene, and other toxic substances. Sometimes acute myeloid leukemia forms a tumor outside the bone marrow. Chronic myeloid leukemia is slowly progressive. This type is linked to a dysfunctional chromosome. It can cause abdominal pain, an enlarged spleen, night sweats, weight loss, and other symptoms. Over time, chronic myeloid leukemia can become more aggressive, similar to acute myeloid leukemia. Acute lymphocytic leukemia is seen mostly in children. It involves overproduction of non-functioning lymphoblasts and lymphocytes. All other bone marrow activity is suppressed when this occurs. The cancerous cells can gather in lymph nodes and the spleen, and they can even cross the blood-brain barrier, which makes this type particularly dangerous. Chronic lymphocytic leukemia is slowly progressive. The cancerous cells can accumulate in bone marrow and lymph nodes. This type has been identified as a complication of Agent Orange exposure. Interestingly, CLL can be so stable that no treatment is recommended. The patient is simply monitored over time. The signs and symptoms of leukemia reflect the suppression of normal blood cell production. Fatigue, low stamina, and anemia occur due to low red blood cell count. Easy bruising and prolonged bleeding result from low platelet count. Low immunity, called neutropenia, makes patients vulnerable to infections. Additional symptoms include fever, weight loss, abdominal pain, and enlarged lymph nodes. Treatment and medications for leukemia depend on the type and stage at diagnosis. Chemotherapy, bone marrow transplant, and biologic agents are increasingly used. Medications to mitigate side effects of treatment are also an important part of the overall care plan. When working with leukemia clients, understand that people with leukemia are more likely to have bruising, bleeding, and vulnerability to infection due to their compromised immune system. A person undergoing treatment has other challenges that require consultation with the healthcare team before providing massage. On the positive side, massage can help reinforce the parasympathetic state, which promotes healing. It can improve sleep and appetite and reduce pain and anxiety. However, these benefits require appropriate training and accommodations. Accommodations for leukemia clients include adjusting pressure and application of massage techniques to account for their fragile state. Limit the risk of spreading infection by following strict hygienic practices. Many benefits of massage for leukemia patients have been demonstrated in research, including pain relief, improved sleep and appetite, reduced anxiety and fatigue, and better quality of life measures. Now let's examine myeloma, which literally means marrow tumor. Myeloma is a blood cancer of B cells that develops in the bone marrow. Unlike leukemia, which affects the blood itself, myeloma can erode into bone tissue, causing additional complications. Myeloma demographics show that it's mostly seen in people over 50 years old. African Americans are the most affected population, while the disease is rarest among Asians and Pacific Islanders. The pathophysiology of myeloma involves tumors growing in the bone marrow. These tumors interfere with normal blood cell production. Additionally, the myeloma cells secrete chemicals that erode bones, leading to bone weakness and fractures. In myeloma, immature B cells mutate and proliferate in the bone marrow, particularly in the spine, pelvis, ribs, and skull. These are called plasmacytomas. Myelomas produce non-functioning antibodies called monoclonal immunoglobulins, or M proteins. These M proteins can fragment and accumulate in the kidneys, where they are detectable in urine. This accumulation creates a risk of kidney damage. There are 3 types of myeloma. Solitary myeloma, also known as plasmacytoma, is a single tumor that can occur in bone marrow or soft tissue. It may progress to multiple myeloma over time. Multiple myeloma involves several tumor sites in the skeleton simultaneously. This is the most common form, accounting for 90% of diagnoses. Extramedullary myeloma involves multiple tumors outside of the bone marrow, affecting skin, muscles, lungs, and other tissues. Myeloma is often silent during early development, with no obvious symptoms. Then, as the disease progresses, symptoms appear. These include pain and signs of nerve tissue compression as tumors grow. Fractures become common due to bone erosion. Anemia and infections occur due to suppressed bone marrow function. Kidney problems develop from M protein accumulation. Hypercalcemia or high calcium levels result from bone breakdown. Amyloidosis, a protein buildup disorder, can develop. Peripheral neuropathy or nerve damage in the extremities is also common. Treatment for myeloma is challenging because it's often non-responsive to treatment. The 5-year survival rate is low. Treatment options include chemotherapy, stem cell transplant, and other medications to help with symptoms. For clients with myeloma, there are significant risks to consider. Bone density may be low, creating a high risk of fracture with any pressure or manipulation. Kidney damage and the risk of renal failure are serious concerns. However, gentle, non-invasive touch may be welcomed by these clients for managing pain, anxiety, and sleep disturbances. Any bodywork must be extremely gentle and carefully adapted to the client's condition. Accommodations for myeloma clients require specialized knowledge. First, adjust pressure, positioning, and other elements for client safety. Second, get advanced training in oncology massage therapy to understand the specific needs and contraindications for cancer patients. Third, you can receive more information through specialized oncology massage resources and continuing education. It's time to discuss sickle cell disease. This is a genetic condition that results in abnormal hemoglobin production. When the hemoglobin is abnormal, red blood cells collapse and cannot pass easily through capillaries. This creates blockages and reduces oxygen delivery to tissues. Sickle cell disease is an autosomal recessive condition, meaning a person must inherit the gene from both parents to have the disease. The demographics of sickle cell disease show certain races are most predisposed to carry the sickle cell disease gene. These include African Americans, Hispanics, and people of Mediterranean descent from countries like Italy, Greece, and Turkey. The gene originally provided protection against malaria, which is why it's more common in populations from regions where malaria was prevalent. The pathophysiology of sickle cell disease depends on genetic inheritance. If a person inherits one gene, they carry the trait but don't have the disease. If a person inherits two genes, one from each parent, they have sickle cell disease. In this case, hemoglobin production is abnormal. The red blood cells collapse into a sickle or crescent shape. The lifespan of these abnormal red blood cells goes from the normal 4 months down to just 10 days, leading to chronic anemia. The signs and symptoms of sickle cell disease include pain, fatigue, shortness of breath, pallor or paleness, jaundice, and various complications that we'll discuss in detail. Sickle cell disease leads to numerous serious complications. Sickle cell crises involve blockage in capillaries and infarction or tissue death. Organ damage occurs, infection risk increases, gallstones form, vision loss can occur, and acute chest syndrome damages cells in the lungs, leading to pulmonary hypertension. Other complications include delayed growth, skin ulcers, avascular necrosis, or bone death, and priapism in men. Treatment and medications for sickle cell disease focus on one main goal: limiting the severity and frequency of sickle cell crises. For acute pain during a crisis, over-the-counter pain medication and hot packs can provide relief. More severe cases may require transfusions and opioids for pain management. Bone marrow transplant is a potential cure but carries significant risks. Other medications include hydroxyurea, prophylactic antibiotics, analgesics, antibiotics, and folate supplements. When working with clients who have sickle cell disease, understand that they have compromised cardiovascular function. Careless massage could exacerbate the risk of sickle cell crisis by potentially dislodging blockages or increasing circulatory demands. However, massage therapy for pain relief and anxiety is often welcome by these clients when applied appropriately and gently. Accommodations for sickle cell disease clients include using gentle touch for pain relief. Work that demands cardiovascular adaptation may be too intense and should be avoided. Many people with sickle cell disease pursue massage therapy, which means massage therapists have a responsibility to be familiar with this condition. Research shows that children with sickle cell disease who receive massage have less depression, anxiety, and pain, and showed improved function. Our final condition to discuss today is thrombophlebitis and deep vein thrombosis. These are conditions where veins become inflamed and obstructed due to blood clots. This is a genetic condition resulting in abnormal hemoglobin, where red blood cells collapse and cannot pass easily through capillaries. It follows an autosomal recessive inheritance pattern. Let me clarify the definition more accurately. Veins of the systemic circuit become obstructed and inflamed due to blood clots. This usually occurs in the calves, thighs, and pelvis. Thrombophlebitis affects the superficial leg veins, specifically the lesser and greater saphenous veins. Deep vein thrombosis, or DVT, affects the deeper leg veins, including the popliteal, femoral, and iliac veins. DVT is generally more serious due to the larger size of these veins and the greater risk of embolism. The demographics of thrombophlebitis and deep vein thrombosis are significant. It's estimated that 5% of the population will have at least one blood clot in their lifetime. Of those, 40% show evidence of pulmonary embolism. This condition is seen mostly in people over 40 years old. Tragically, PE is the leading cause of in-hospital mortality. Understanding the pathophysiology helps explain the dangers of these conditions. Thrombi are stationary clots that remain attached to the vessel wall. If they travel or embolize, they go to the lungs, which can be life-threatening. The clotting mechanism is vital for healing, but sometimes clots form faster than they melt, leading to dangerous accumulations. The pathophysiology of thrombosis is explained by Virchow's triad, which identifies three main factors that contribute to clot formation. First is endothelial injury. Second is hypercoagulability. Third is venous stasis. When these three factors come together, the risk of thrombosis increases dramatically. Many common factors can precipitate thrombophlebitis and deep vein thrombosis. These include physical trauma, varicose veins, particularly perforator veins, local infection, physical restriction from tight clothing or positioning, immobility from bed rest or long travel, pregnancy and childbirth, cancer and cancer treatment, inflammatory bowel disease, surgery, and hormone supplements. Other contributing factors include cigarette smoking, cardiovascular disease, paralysis, high altitude, and genetic conditions that affect clotting. Complications from these clots can be severe. If clots fragment, they go to the lungs, unless there's a hole in the septum of the heart that allows access to arteries. If clots reach the arterial system, they can cause stroke, heart attack, or arterial embolism. Permanent damage to leg veins can occur, leading to post-thrombotic syndrome. This syndrome causes pain, discoloration, varicose ulcers, and slow healing of wounds. Signs and symptoms of thrombophlebitis and DVT vary. Sometimes there are signs of inflammation, including pain, heat, redness, and swelling in the affected area. Patients may experience itching, a hard cord-like feeling in the vein, distal discoloration, and skin damage. With infection, signs of systemic illness appear. Importantly, the condition can be silent until signs of PE develop. DVT is more threatening than superficial thrombophlebitis because it involves bigger clots, causes more damage, and carries higher risk of serious complications. Treatment and medications for thrombophlebitis and DVT have two main goals. First, prevent existing clots from growing or embolizing. Second, prevent future clots from forming. Medications used include aspirin, anticoagulants, and thrombolytics. Pneumatic compression devices and support hose help promote blood flow and prevent pooling. The risks and benefits of massage for clients with thrombophlebitis or DVT must be carefully considered. A person with a diagnosed clot is at risk for PE. Similarly, a person with signs of clots is at risk for PE. Anticoagulants increase the risk of bruising and bleeding, so lighter pressure must be used. Post-thrombotic syndrome can cause skin damage that requires special attention. On the positive side, someone who has fully recovered from thrombophlebitis or DVT without other problems is a good candidate for massage therapy. Accommodations for clients with thrombophlebitis or DVT require careful decision-making. If the clot is stable and the client is encouraged to exercise by their physician, gentle massage proximal to the affected area may be safe. Accommodate for anticoagulants by using pressure that will not cause bruising. Watch for compromised skin and varicose ulcers that may be present. It's crucial to know that adverse events regarding massage and DVT are documented in the medical record, meaning there have been cases where massage caused harm. This concludes part 1 of our lesson on the circulatory system. We've covered the fundamental structure and function of the cardiovascular system, including the heart, blood vessels, and blood components. We've explored several important cardiovascular conditions, including anemia, embolism and thrombus, hemophilia, leukemia, myeloma, sickle cell disease, and thrombophlebitis with DVT. Understanding these conditions and their implications for touch therapy is essential for safe and effective practice.